Applestosen. It's Dr. Bob here with another health and vitality solution tip. Today is an important topic. It's called a medication overuse headache. It's estimated that more than 50 million people on a daily basis take medication for headaches. It is one of the most prescribed and non-prescribed reasons why people take a medication in our country. A lot of people think that it's the more involved medications that create these rebound headaches, like Vicodin, codeine, and some of the harder medications. But even things like Tylenol, Aleve, Advil, Motrin can create this rebound headache. So the reason, what happens is you typically get a headache, and if the persistence stays there and nothing is done to correct the pressure on the nerves, and they say that 57% of headaches come from the neck specifically, more than half, if the spine is not in alignment. So a person starts taking a medication for a period of time, and then they start to go off the medication. Within a day or two later, they start to get a headache again because they didn't actually correct the underlying problem. So they take the medication again, and then they try and go a few days, get off the medication one more time, and they get this headache, so they think it's just the problem that needs to be alleviated. And then over a period of months and years, a person starts taking medications on a regular and consistent basis. Now what happens is, as you start to wean yourself off of these medications, this rebound effect, your brain actually goes through chemical and anatomical changes. You become addicted to the painkillers. It works on what's called the dopamine reward system, the circuitry of a certain part of the brain, in the midbrain, that deals with a cycle for pleasure centers. And so it knocks that pain out, so you actually feel more pleasure. And psychologically, you get addicted to the medication because you feel better. But if you don't actually look at the underlying problem and really get to the core of the pressure on the nerves, the headache continues to go on and on. Now, a person can actually start to take these medications for many years. We've worked with several different organizations with professionals, medical doctors, attorneys, high-level people that are in this 30-day program to actually get off of Vicodin. Vicodin is a heavily addictive drug, and what happens is a person gets more and more involved, and a lot of these people that do this can actually go into other addictive drugs. Cocaine, heroin, different barbiturates have the same receptor sites and can cause this dopamine reward circuit to actually fire off. So the problem is we're actually altering this pleasure reward center in our brain, and if we don't stop the cycle and really get to the cause, if it is coming from the neck or some sort of chemical imbalance, there can be stress. So our thinking can actually cause headaches. There can be old traumas that were never taken care of that can cause headaches, especially in the cervical spine, or head traumas. Or there can be toxicity in the body, maybe the foods that we're eating. Any type of preservative causes the brain to create an inflammatory response. Things like aspartame, which is a NutraSweet, to MSG, and high fructose corn syrup, to trans fats. Those are all chemicals that are altered, and it changes the shape of the chemical, which bypasses the blood-brain barrier. So these problems create an inflammatory response. So our brain sees, our immune system of our brain, the glial cells, say, hey, there's something foreign here, and it creates inflammation and starts to fight almost like an infection. So you can have a chronic inflammatory response going to the brain, causing these headaches. And you keep taking the medication, getting these rebound headaches. So it's always best to look at the cause. Make sure that you're evaluating the nervous system. Make sure that you're looking at your lifestyle, what you're eating, the stresses in your life, and start to eliminate those toxicities and the old traumas and our stinking thinking thoughts, and then you can go off of some of these medications much easier without this rebound. Anytime a person goes off of medication, you should look, if you've been on it for a long period of time, with some sort of professional that can guide you through the process so that you can slowly wean yourself off and take this seesaw of being on the medication to going off to restoring your life back to its normal balance. So today's topic is on medication overuse headaches and rebound headaches. So if you've never had your spine checked, if you've never had a doctor, a wellness doctor, look at your overall lifestyle to make some change. I recommend that rather than getting stuck with the 50 million people that take medication on a regular basis for headaches. So So that's your tip of the week. Evaluate your lifestyle to change your life. Until next time, apples dozen.